I've had neuropathy for, I would say, 17 years plus. The best way that I can explain my disease, it's like somebody's got a voodoo doll of me. And that some days they're sticking pins in my feet. And then it could change in minutes, and it's like somebody's beating my feet with a hammer. Then later on, it could switch where somebody's holding my feet over a flame. Then sometimes it feels like there's thousands of bumblebees in my feet trying to sting me from the inside out. This is 24 hours a day. 24 hours a day. And I've been going through this for years. Why were my feet doing this? What is this? It's in my hands. It's in my whole body. I've been sent to a neurologist. And so when he finished, he just shook his head. When I stop and think about it, I was just wondering, if there's no cure for this and my nerves are shot, where's this going? I hate to say it, but could I lose my life behind this? I just deal with this every day the best way I can. And I try to smile and thank the Lord every day.
So what is peripheral neuropathy? Peripheral neuropathy is when tiny nerves in the feet, legs, hands, or arms stop working properly. When a nerve stops working properly, signals from the brain don't reach the cells. It's like static on a phone line. As the nerve damage progresses and the nerve begins to die, cells surrounding the nerve die too. Other common symptoms include loss of coordination and dexterity, which puts you at increased risk for accidents of all sorts. Inability to feel clothing like socks or gloves. Painful muscle cramps and leg spasms that can take the fun out of any activity and keep you up at night dealing with pain. Increased risk of falling, which makes a simple walk through the house a potentially dangerous activity. Burning sensations in your arms, legs, hands, or feet that may start out mild, but for many eventually become painful. Pain, which can become so bad it is all you can think about.
It's very painful, very difficult to sleep at night when it gets to hurting really bad.
Burning, stinging sensation in my feet.
It was just tingling and burning and feet moving all the time, couldn't control them.
Tingling and burning and numbness and discomfort and interfering in your lifestyle, and I thought, that's me.
What causes peripheral neuropathy? There are many causes of neuropathy. Diabetes and prediabetes accounts for the majority of neuropathy cases.
I've been a diabetic, or I was a diabetic, for 15 years. 350 pounds, hardly able to walk. This is 2 months worth of my medications. That is a ridiculous amount of medication. It's so hard for me today when I hear someone talk about all the medication that they're on, and I'm just thinking, you know, I have been there. I have been on that medication. And that's not a good place to be. I wish I could tell everybody. I'm gonna lose it.
followed by toxic effects of medications, alcohol, and environmental toxins, as well as surgery, physical trauma, infections, and autoimmune disorders. What most of these causes have in common is they are all associated with inflammation. Time magazine named chronic inflammation the silent killer because inflammation damages your blood vessels. You know how important blood is to your heart. If your heart's blood vessels are damaged by inflammation, then blood flow will be diminished, and your heart will grow weak and eventually begin to die. Well, it's similar with peripheral neuropathy, except this is happening in the tiny nerves in your feet, legs, hands, and arms. If blood flow to these nerves is diminished, the nerves will begin to degenerate and die. This is a healthy nerve. All nerves need blood and oxygen. That is their life source. This is a blood vessel. It supplies the blood and oxygen the nerve needs. What do you notice is different about this nerve versus this nerve? In the second illustration, you can see that the nerve is damaged. This will decrease the blood supply, leaving the damaged area feeling numb or tingling. So as the blood vessel continues to be inflamed and degenerate, what happens to the nerve? The nerve gets worse and eventually dies. How does that turn up as symptoms in your body? How well do you think the nerves are sending the correct signals to the brain? Not well at all. So how well do you think that nerve is going to work? Not well. You will start to experience pain, balance issues, etc. So if that happened to the nerve that controls your balance, how is your balance going to be? Not good. Along with pain, one of the main concerns with neuropathy is loss of balance. When balance becomes a problem, falls become of increasing concern. In 2013, the total cost of fall injuries was $34 billion. Falls account for 25% of all hospital admissions and 40% of all nursing home admissions. 40% of those admitted do not return to independent living. 25% die within a year. 1/3 of Americans age 65 plus fall each year, and there are more than 21,700 deaths, all because of falls. The risk of falling is greatly increased when you have neuropathy. That is only one of the many complications patients develop with neuropathy. You have several different nerves. One controls pain, one controls numbness, one controls burning, etc. Depending on which nerve gets affected is what you are eventually going to feel as these symptoms. Symptoms are simply damaged nerves misfiring signals to the brain. When the blood supply has been damaged to all nerves over time, that is when the nerves look like this. When patients reach this stage, the nerves in their feet have no blood supply left and are dying off. What color would these patients' feet be? This is what we are trying to avoid, and the saddest part is that at this stage, we can't help them. They waited too long. This is where this disease goes. We have to refer out these patients, and there is only one option for them at this point. Any guesses what that would be? Amputation. Many have the misconception that you would need to be at end-stage neuropathy with purple feet to be at risk for amputation. Another major and common problem patients at this stage of neuropathy incur is ulcerations on their feet. In a study of diabetics, 29% developed an ulceration on their foot. But do not misunderstand, it is not only diabetics that develop ulcerations. Pre-diabetics and diabetics just have a greatly increased chance of ulcerations. The blood vessels and nerves are not functioning properly and are unable to properly heal a wound. If someone with neuropathy stubs their toe, the wound takes much longer to heal. An open wound over time can develop an infection. Once the infection spreads into the bone, surgery to remove the bone is necessary. The most accurate way to describe peripheral neuropathy is creeping nerve death. A big problem with peripheral neuropathy is the first symptoms are often mild. A little tingling or numbness may be all you notice, but over time, weeks or months, possibly longer, the tingling or numbness grows. Eventually, it's impossible to not notice. Painful muscle cramps and muscle spasms, loss of balance, fear of falling, all this and more is common as symptoms progress. Then over more time, slow or fast, depending on the person, the burning starts. The pain turns on, and the suffering begins. Without proper treatment, this condition can destroy your quality of life, land you in a wheelchair, and make you completely dependent on others. Statistics tell us that neuropathy patients usually get worse slowly over the first few years. They don't even notice their symptoms sometimes.
My name is Teresa McKay. I live in Apple Valley, California. I went to the doctor and he sent me to a neurologist and they diagnosed me with the neuropathy. I just started feeling the tingling and my legs burning, and my hands started getting bad. I couldn't write. I couldn't pick up things with my hands. I couldn't brush my kids' hair. I was in chronic pain every day. I couldn't even sleep at night. I would lay in bed and be like, God, why is this happening, Lord? I was very healthy before. And then to not be able to walk, I was just ready to give up. I wanted to die.
She was in the bed and she couldn't get out, literally could not get out because she had no balance. I couldn't do this anymore. I couldn't see her just lying there. I got to do something because this is not my sister. I'm not going to sit here and watch her die because she had already given up. I loved her so much.
The problem is that most people really don't pay attention till about here. But the real problem is down here. How do you think your symptoms would be if you got here? Most importantly, at this stage, we can't help. It has progressed too far. These patients have waited too long. Some people mistakenly comment lightly that they only have symptoms every now and then. Does that mean the nerve is normal, or is that nerve damaged? Damaged. What is going to happen to you if you just leave it alone untreated? Statistics have proven again and again that if these symptoms are left untreated, patients risk increased immobility, being confined to a wheelchair or walker, and worst case, amputation. Until recently, doctors have not understood the basic cause of neuropathy, and their only hope in treating it was to prescribe medication or surgery, both of which left the patient in a worse condition than when they started. Many patients talk to their MDs about neuropathy, and one of two things happen. 1. The MD prescribes medications and tells the patients nothing can be done. 2. The MD will refer them to a neurologist. A neurologist will do an NCV, which only tests the large fiber nerve. There are 3 nerves that can be affected when a person has neuropathy. A person may have only 1 to 2 nerves affected at the beginning stages of neuropathy. NCVs testing only one of the 3 nerves can produce a false negative for neuropathy. If the NCV does test positive for neuropathy, the neurologist will prescribe medication. Medications for neuropathy are not like antibiotics that will rid the body of neuropathy. There is no magical drug that does this. The medications prescribed by primary care doctors and neurologists are the same. 1. Pain medications. 2. Anti-seizure medications to slow down the brain so it does not receive the misfiring signals. This causes a patient not to feel the symptoms. Many of these drug side effects can be blurred vision, double vision, clumsiness, unsteadiness, dizziness, drowsiness, or trouble with thinking. This medicine may cause you to have extra fluid or to gain weight. This may cause problems for people with heart failure. So this is prescribed to people with balance issues, numbness and pain, and now may make them dizzy and impair driving. The frightening thing about these medications is that the patient has a false sense of hope not feeling the symptoms, though nothing has been done to slow, stop, or reverse the degeneration of their nerves. They don't feel it, but they are getting worse. As a result of this, sometimes patients will tell their doctors that the medication is becoming less effective and they are feeling symptoms again. This is not necessarily the case. The neuropathy is degenerating and the symptoms are getting worse. The same old dose may not cut it, so the doctor increases the dose and the symptoms go away again. All the while, the patient does not realize just how bad they are getting. Here, the doctor will begin to prescribe antidepressants to help patients cope with the impact of poor quality of life as they become more immobilized and lose the independence they once enjoyed. Why don't MDs do this type of treatment? If you were not referred here by one of our referring MDs or neurologists, most likely they know nothing of our treatments, and here's why. Medical doctors are bound by something called standard of care. Standard of care refers to what is well known and commonly accepted by most members of the local medical community. So if a treatment is not well known and commonly accepted by most other medical doctors in the community, it is not considered an option. And even without standard of care restrictions, doctors are busy. They barely have time to keep up with their area of expertise. much less keep up with new treatments, new technology, and advances outside their area of expertise. This is why most medical doctors are not aware of the proven treatment program we've used at our Optimal Health clinics to help over 5,000 people suffering with peripheral nerve damage get out of pain and get back active living. The major concern we have is it too late? We will provide thorough testing of each patient to see if you are a candidate for our neuropathy treatment and if you are the right fit for our clinic. If it's too late or you are not a candidate for our treatment, we will let you know what options are left available to you and refer you there. One of our staff will be in shortly to discuss if you are a candidate for our treatment and a good fit as a patient for our care.